Did you know how pharmacotherapy can help in treating diarrhea? Well, let's dive into it. Diarrhea is a common health issue that most of us experience at some point or another. It's more than just a minor inconvenience, though. It's your body's way of coping with disturbances in the digestive system. Now, these disturbances can be caused by a variety of factors, ranging from infections and food intolerance to certain medications and diseases. The symptoms of diarrhea are unmistakable. Frequent and loose or watery bowel movements, abdominal cramps, bloating, and in severe cases, fever or blood in the stool. While it's not a pleasant topic to discuss, it's important to understand that diarrhea can have a significant impact on the body. It can lead to dehydration, electrolyte imbalance, and even malnutrition in chronic cases. So, how do we combat this? This is where pharmacotherapy comes into play. Simply put, pharmacotherapy is the use of drugs or medication to treat disease. In the context of diarrhea, pharmacotherapy involves the use of medications to either alleviate the symptoms or target the root cause of the disturbance in the digestive system. There's a wide range of medications available for treating diarrhea, from over-the-counter drugs that help reduce the frequency of bowel movements, to prescription medications that target specific pathogens or mechanisms causing the diarrhea. But pharmacotherapy is more than just popping a pill. It's a carefully designed treatment plan that considers the patient's overall health, the severity of the diarrhea, and the potential side effects of the medication. It's a delicate balance that requires careful monitoring and adjustment, and it's why consulting a healthcare professional is so crucial when dealing with persistent or severe diarrhea. Pharmacotherapy has revolutionized the way we approach diarrhea, transforming it from a potentially life-threatening condition to a manageable one, but like any treatment, it's not a one-size-fits-all solution. So, how exactly does pharmacotherapy work in treating diarrhea? Stay tuned to find out. To understand how pharmacotherapy works, you first need to comprehend the mechanism of diarrhea. So let's delve into the nuts and bolts of this common yet complex medical condition. Diarrhea is more than just frequent trips to the restroom. It's a sign that something is off within your body, specifically in your digestive system. It occurs when the balance of fluids and electrolytes in your body is disrupted. Your intestines act like a highly efficient transport system, absorbing nutrients and water from the food you eat and excreting the waste. In healthy conditions, the water and electrolytes, these are minerals such as sodium, potassium, and chloride, are absorbed back into the body, leaving a semi-solid waste. However, in the case of diarrhea, this absorption process is hampered. The intestines either secrete too much fluid or do not absorb enough, leading to loose, watery stools. This imbalance can be caused by a multitude of factors. Infections, such as those caused by bacteria, viruses, or parasites, can irritate the intestinal lining, leading to excessive secretion. Certain medications, foods, or medical conditions can also impair the absorption of water and electrolytes. The loss of excessive fluids and electrolytes is what makes diarrhea a potentially dangerous condition. These elements are vital for the normal functioning of your body, including muscle contractions and nerve signaling. Losing too much of them can lead to dehydration, which, if not managed, can be life-threatening. The key to managing diarrhea, therefore, lies in rehydration. It's crucial to replace the lost fluids and electrolytes to prevent dehydration. This is where oral rehydration solutions come into play. They are specifically designed to replenish both fluids and vital electrolytes, helping the body regain its balance. Now that you understand how diarrhea works, let's dive into the world of pharmacotherapy. It's a fascinating journey where we'll explore how medicines can help manage and treat this condition effectively. So, buckle up for the next exciting chapter in our exploration of the pharmacotherapy of diarrhea. Ever wondered how medications can help treat diarrhea? Here's your answer. Pharmacotherapy, or the use of drugs to manage disease, plays a critical role in treating diarrhea. This treatment approach primarily focuses on alleviating the symptoms, restoring the body's water and electrolyte balance, and, in some cases, attacking the root cause of the problem. Let's start with the basics. When diarrhea strikes, the body loses fluids and salts, which can result in dehydration. That's where oral rehydration salts, or ORS, come into play. ORS is a mixture of salts and sugars, which, when dissolved in water, is incredibly effective at replenishing lost fluids and preventing dehydration. Then we have anti-diarrheal agents like loperamide, a popular over-the-counter medication. Loperamide works by slowing down the movement of the gut, This reduces the speed at which the contents pass through, allowing more time for water and electrolytes to be absorbed back into the body. But what if the diarrhea is caused by a bacterial or parasitic infection? In this case, antibiotics or antiparasitic medications may be prescribed. These drugs are designed to kill the harmful microorganisms causing the issue, helping to clear the infection and alleviate the symptoms. Probiotics, too, have a role to play in combating diarrhea, particularly that caused by antibiotics. These are good bacteria that help restore the natural balance of bacteria in the gut, promoting a healthier digestive system. However, it's important to remember that not all diarrhea can or should be treated with medication. For instance, diarrhea caused by certain types of food poisoning may be better left untreated, as the body needs to clear the toxins naturally. Also, while these medications can provide quick relief, they should not replace the need for adequate rest and a proper diet. Overuse or incorrect use of these medications can lead to complications such as chronic constipation or dependency. In conclusion, pharmacotherapy can be a powerful tool in managing diarrhea, but it's not a one-size-fits-all solution. Understanding the cause and nature of the diarrhea is key to choosing the right treatment strategy. These medications, while effective, need to be used correctly to prevent complications. Using medications correctly is crucial in the treatment of diarrhea, but how do you ensure that? Let's delve into the details. When it comes to using medications, the first rule of thumb is to follow the prescription. It's not just about taking the right drug, but also about the right dose at the right time. This is because the effectiveness of a drug is often determined by its concentration in the bloodstream, which is directly influenced by dosage and timing. Now you might wonder, what if I miss a dose? Well, the answer is simple. Don't double up the next one. It can lead to an overdose. Instead, take the missed dose as soon as you remember, unless it's almost time for the next one. In that case, skip the missed dose and continue with your regular schedule. Next up, let's talk about potential side effects. Every drug has them, and those used for treating diarrhea are no exception. Some common side effects include nausea, vomiting, stomach cramps, and sometimes even constipation. While these are usually mild and temporary, it's important to keep an eye on them. If they persist or become severe, it's time to consult your healthcare provider. Furthermore, it's essential to keep in mind that not all drugs are suitable for everyone. Factors like age, overall health, other medical conditions, and currently taken medications can significantly affect the choice of drug and its dosage. Therefore, always make sure to provide your healthcare provider with all necessary information. Lastly, remember that while medications can effectively control diarrhea symptoms, they're not a substitute for proper hydration and nutrition. So don't forget to drink plenty of fluids and eat a balanced diet. In conclusion, the right use of pharmacotherapy involves careful adherence to dosage instructions, constant monitoring for side effects, and maintaining open communication with your healthcare provider. Remember, the misuse of medications can lead to severe complications. Ensure to always use medications responsibly. Let's recap what we've learned about the pharmacotherapy of diarrhea. This complex condition, more than just a nuisance, can be a serious health concern if not managed correctly. Understanding its mechanism is the first step to effective treatment. Diarrhea is a symptom, not a disease, and it's the body's way of ridding itself of harmful substances. It's characterized by an increase in the frequency, volume, and fluidity of bowel movements. The mechanism of diarrhea involves a disruption in the delicate balance between the absorption and secretion processes in the intestines. Pharmacotherapy plays a crucial role in managing this condition. The medications used aim to slow down intestinal transit time, reduce fluid and electrolyte losses, and treat the underlying cause if it's known. Remember, these medications don't cure diarrhea but help manage the symptoms, giving your body time to recover. We delved into the world of anti-diarrheal drugs, discussing over-the-counter options like loperamide, which slows intestinal movement, and bismuth subsalicylate, which has antibacterial properties and can soothe inflammation. We also talked about prescription medications like antibiotics and antiparasitic drugs for specific causes of diarrhea. But it's not enough to just know the medications. The correct use of pharmacotherapy is equally important. Self-medication can sometimes do more harm than good. It's essential to use these drugs as directed by a healthcare professional and not to rely on them as a long-term solution. Hydration and nutritional support are also vital aspects of managing diarrhea. And let's not forget the importance of prevention, including good hygiene practices and safe food and water consumption. So there you have it, a comprehensive look at how pharmacotherapy can help in treating diarrhea. The journey we've taken today is a testament to the intricate nature of our bodies and the fascinating field of pharmacotherapy. It's a reminder that even the most common ailments require understanding, care, and the right approach to manage effectively. Subscribe for more because you won't find me later. Stay healthy!